So when it comes to anesthesia, we will be able to recommend the most appropriate and safest anesthetic for your type of surgery. And we will do this by taking into account your existing medical conditions, previous anesthetic experience, as well as your preference. This will be discussed with you in detail, and you will have the opportunity to make an informed decision. There will also be opportunity for you to fully understand the detailed procedures and agree with what is planned for you. There are many types of anesthesia, and these include general anesthesia, epidural or spinal anesthesia, as well as nerve blocks and sedation. A general anesthetic is where you are fully unconscious during your operation. Anesthetic drugs, as well as potent painkillers, are administered intravenously through a vein that render you unconscious. When you're asleep, your anesthetist will look after you. Oxygen and anesthetic gases will be administered via an airway device. The advantage of a general anesthetic is that you are completely unconscious during your operation. However, because we use potent painkillers such as morphine, there is the possibility that this may make some people experience nausea after the operation. Spinal and epidural anesthetics are used for operations below the waist. A very fine needle is inserted in the middle of the lower back into the spinal space, and local anesthetic is injected through this needle into the spinal fluid that surrounds the spinal nerves. The local anesthetic numbs these nerves and renders the lower half of the body anesthetized. In addition to the spinal anesthetic, your anesthetist may administer sedative drugs through your intravenous line that will make you relaxed and sleepy. This is not a full general anesthetic, however, and you may from time to time be aware of voices or general theater activity. Nerve blocks are where local anesthetic is administered in proximity to nerves to make them go numb, and these can be placed peripherally in either limbs, upper limbs or lower limbs. The local anesthetic numbs the nerves and anesthetizes that part of the limb to ensure pain relief for several hours afterwards. You may not be able to move that part of the limb properly for that duration. The advantage of nerve blocks is that it reduces the amount of morphine that you may need, and therefore it obviates postoperative nausea and vomiting to some extent. When you meet your anesthetist, he or she will discuss the various options for you and your particular surgery. This will give you an opportunity to make a shared decision about what is most appropriate for you and that particular circumstance.